Welcome to At the Nurses Station with Kelly and Sam, a podcast for nurses about everything except the patients. Happy, finally, officially December, Kelly.
Yeah.
There was snow. It's rainy here and wet. And
Yeah, my kids ran out and made a snowman, which I was surprised they could get enough snow to make one. And I was so happy to see them all playing out in the snow in this big old snowman. And then I looked out there like 2 minutes later and they had karate chopped that thing down. And I was like, oh, you worked so hard on it.
there needs to be like snow rain gear because my kids go out there too with all their snow gear on, and then it just comes in freaking soaking wet. There's nothing to do but put it in the dry. The inside of my youngest like snow gloves smells like a wet towel so bad, and I just can't get it. And I put it on like the little glove dryer. It doesn't matter. I have a question for you before we jump into this. So last night I was asked if you were my best friend, and I said no, but I have to tell you, it felt very aggressive and mean to say it. And the person that asked me, she was like, well, you're best friends with Kelly, right? And I was like, I feel
No.
like if I say no, you're gonna interpret that as me not being good friends with her, but also like she's not my best friend because
Right.
that's only like a one slaughter, but she's a good friend anyway. So I just thought I'd bring that up to you. How do you answer no to that question without sounding like you're not friends?
Well, I feel like that's kind of a weird question to ask someone that doesn't know you very well. Like, because even though like we know everybody at work as work friends, right?
Yeah.
I don't know their personal lives like in
Yeah,
and
you do.
out. And
Okay.
yeah, but like on a different level, right? Like I'm not texting you at 3 a.m. when I have an argument with my husband and I'm sobbing. You know, that's my best. Who you are. You're listening to this.
I know that you're a chef and that I might make you uncomfortable, but I really want to get to know you someday. I think you're great.
And you have 2 best friends from high school.
I do. Yeah.
I know
Well,
that.
and that was the thing. It was like, I feel like by 30 and a lot of change, it just, there's so much background to make the best friend that it's like, even knowing you for like 7 years, it's like, well, it's not 20 years.
Yeah. Yeah. It's like you're not gonna, well, I don't think anybody's gonna take that slot that has been
Right.
cemented in time.
Totally. But it just felt the way the question was, and of course there's other people sitting there and it's like, "Hell, is your best friend, right?" No, but that doesn't mean that we're not wait, I'm so
Yes.
sorry. Can you just tell me what your next question is and I'll answer that one?
I
What do you
love
need to
that.
know?
I wish we would have both been there. Then we both look at each other and be like, no,
No.
but I love you.
That would have been better. But yeah, I was like, I do a lot of stuff with Kelly, but I don't know. Yeah. So, okay. Well, that was pretty much
Well,
yeah.
you're insane. You just worked 3 16s in a row.
We don't talk about it though. There's a rule, Kelly. You
Oh, I'm
can't.
sorry. We can't talk about overtime. That's right.
Well, I mean, I guess we can talk about it now after the fact, but like there is if you bring it up, it has to be in a way of like, I don't know what, like maybe you ran out of food or something. And you're like, oh, well, I'm working a 16 and like I ran out of bean burritos, which 100% happened to me last night. But it can't be in a there's people that do it in a whiny way. And I just have a real, like, visceral, I think that that's like a moral failing when you voluntarily work a 16 and then bring it up all the time.
Well, I guess I didn't mean it like that, but I know that there was someone a while back that was complaining about working overtime on social media, and I think they got in trouble because I don't know that the hospital wants people to know how much overtime we actually work.
Wait, do you mean someone like just someone or like someone in our department?
No, someone like in the hospital years ago. I just remember this happening because I think it was like you can't like tell the world how much nurses work overtime because it makes the hospital look bad.
Oh, that's the thing? Not like the dirty floors or like the jank pieces of wall that are missing or like stuff that doesn't close properly. It's the
Yeah,
fact that their nurses are dedicated to their job and to patient care, so they work crazy hours. That's what makes them
right.
look bad.
Yeah,
Okay.
I guess so. I guess that's what they
Okay.
put out into the ether, but yeah.
But yes, I did. I worked, but I just want to be at work as many hours as I can on the weekend and then not look back on the days that I'm not there. So
Yeah, because you never work during the week, which is nice.
yeah, very rarely will I pull a weekday shift. Um, Never a weekday shift, but yeah, it was good. I wish that I could change my unit every 4 hours. That I would work a 16 every shift if I could go to like the adult ED and then the peds ED and then like I don't know, 4 hours on like mom baby and then like 4 hours in the PICU. I don't know. I don't work on those units, but like I could do that. 4 hours
Yeah.
goes by so fast. It's easy.
Well, that's what's kinda nice is, I mean, most units, you have one assignment and you stay there for 4 hours or for the entire 12 hours, but a
Yeah.
lot of times we bounce around to, like, different sections or, like,
Mhm.
I'll be in psych for 4 hours and then I'll be charge nurse for 4 hours, so it really does, like, break it up to the point where it doesn't feel like that long.
It doesn't. And shout out to a friend of the pod who, unbeknownst to me, took a 12-hour in psych so that I could float when I came to the adult side or to the ped side. And that was I did not ask her to do that, but that was very, very kind of her. So
Oh.
it was very nice. Yeah. So anyway, speaking of which, one of the kids that I triaged had some problems in life and
Mm.
had just been reintroduced to his mom that evening after an extended time making alternative life choices that sort of coincide with what you wanted to talk about today. So
Yeah.
maybe we could jump in there.
Yeah. Excuse me. Yeah, so I thought because we deal with this all the time and it is a big topic of conversation at the nurses station, I feel like, is addiction and particularly addiction to opiates
Okay.
because of the constant fentanyl overdoses and like the how horrible it has gotten, particularly in our city and on our streets. So
Let's go, Kelly. Let's
I
go.
know, I know. And it's such a like everyone has a different idea of how to deal with this problem. And so I thought it'd be good for us to
Mm.
kind of hash that out. So kind
So
of like
over here, you and me.
I know. So kind of the backstory of like how we got here, I guess, is like 10 years ago it was mostly heroin on the
Yeah.
streets.
Yeah.
And
And
then fentanyl came. And
mm, meth, we did a lot of
oh yeah,
heroin,
well,
right? And then it was like
heroin and meth.
naloxone.
I think
Yeah.
heroin and meth were kind of around the same time, like
Okay. Okay.
early 2000 was like heroin meth time. A lot of people used both.
Mm.
Like they would get high and then they'd get low. Well, get low, get low.
Yeah, that's
Um,
all. Yeah. Mhm.
but I feel like I was trying to do some research of like when fentanyl really like came on board, and it's really just been in like the last decade and is like slowly moved up to now they're saying that there's fentanyl in almost every drug out there. Like
Wow.
it's being manufactured. So most of it comes from Mexico,
Mm.
synthetic fentanyl. I think what's hard for us is we've used fentanyl in the hospital for so long.
Mhm.
And I'm sure you've gotten the look from parents when we say we're giving them fentanyl for pain. And
You're
that's
like,
hard
"This is
because
what
now we
this
have to have this
is?"
conversation. I'm like, no, this is
Mm.
real fentanyl that is like made for the hospital for it's not what's manufactured on the streets.
Can I ask what is so when you say synthetic fentanyl, I'm like, okay, is that like, isn't all fentanyl synthetic? Like, what is non-synthetic
Yeah,
fentanyl?
I guess synthetic opioids is a better term.
So, like, not from poppies?
Yeah, not heroin.
Not heroin. Okay,
It's not heroin.
it's not heroin.
But yeah, haven't you had that where
Opium.
you're like, you have a child
Yeah.
with like an open fracture and a bone sticking out of them, and you're like, okay, we're giving fentanyl. And they're like, wait, no, I don't want that.
I had, like, 2 very specific instances. One, a family that I knew outside of the hospital that had a shoulder dislocation, and I was like, "Okay, and the dad was like, "The stuff that's killing people on the street, you're absolutely not giving it." So then, yes, you have to have the conversation. and then like a trying to die in the trauma room alert car crash kid that was in so much pain. And I'm like, no, like I'm gonna give you some pain meds. He's like, what is it? It's not fentanyl. You're not giving me any fentanyl, honey. This ain't gonna be the thing that kills you today, even if I do this wrong. So, um,
So,
but yeah, it would be nice if there was a different word.
yes.
So,
Yeah, I guess that's what I would like as well.
what is the
Because
other word for like the
like the
like
medical word,
no,
like
yes, like what's the brand versus the I don't know why I'm blanking on this. Fentanyl's the off-brand name. Oh my gosh. Fentanyl and we used to
there's Sublimaze.
Sublimace.
Yeah.
Yeah. And which is what we used to call it when I first started being a nurse.
Yeah.
The Sublimace. Yeah.
So we could go towards using the word Sublimaze instead of fentanyl in the hospital so people think there's a distinction.
Yeah, I mean, it just hadn't occurred to me that it pretty much every other drug, maybe not Zofran because I can't say ondansetron
Mhm.
very well off the jump. But like everything else, we use kind of both, right? Ativan,
Yeah.
lorazepam, um,
Versed.
Versed, yeah,
Yeah.
uh, yeah, everything else but fentanyl. We just maybe propofol we don't use. Like that
Yeah.
one starts with a D, doesn't it? And I can't.
Morphine. We always just say morphine.
We always just say morphine. Dilaudid. We always just say Dilaudid. I guess there are some that we don't use the brand name, but I was just thinking when we're talking about differentiating street drug versus in the hospital, if
Right.
we called it Sublimace, it would
Yeah.
probably go over better.
Yeah.
But yeah.
And I appreciate the fact that like patients and parents are concerned about their child becoming addicted. But here's the thing about getting addicted to drugs, like if you're using it for in the proper way, like to treat pain, that's not
Mhm.
what's going to cause the addiction in your brain. It's using it when there isn't pain.
Well, maybe not fentanyl acutely in the ER, but I mean, the story for a lot of addiction is a slightly bigger than minor injury and they're prescribed oxy, right?
Right. But I also feel like through education and teaching them that you are going to experience some side effects when
Mm,
you wean off of it,
mm,
and telling them to wean off of it can fix that problem. So when I was in my 20s, I got pancreatitis after a procedure I had, and I was in the hospital, had a PCA pump back when they let us use PCA pumps.
yeah.
Went home on oxys,
Mhm,
Oxycontin, not
mhm,
oxycodone. I mean, it was bad news, right?
mm,
And I remember one day waking up and I was like, "Oh, I'm not in pain." So I didn't take medication.
mhm,
And I remember like I think it was probably within the day, like I started having like nausea, I was having like shooting sensations like in my face. Like I was like, I think I have MS. Like which my husband's going to love that because every time something goes wrong with me, I'm like, I have MS. Um And even though I was a nurse and even though like I know all of this stuff, it took me a minute to realize, oh, I'm having withdrawal symptoms.
mm.
And it was like, oh, okay. So then it was like, well, let me take a half dose, get rid of these symptoms tomorrow, and kind of weaned myself off of it. But I had this like realization of, well, I think that's when the addiction happens is when you feel horrible, but then you take it and you feel better. So then they just keep taking it and it's no longer for pain. Now it's to
Not
feed,
have the
not
withdrawal.
have the withdrawal. Yeah.
Mm. Okay, I could see that. I that makes sense. That makes sense to me. I just wonder a little bit, and I don't wanna derail us from where you wanted to go with this, but,
No,
like,
no.
do we need to treat pain as aggressively as we do?
I think that um over the last like 5 years, that's what they've
That's
really
just
pushed. Yeah. I think that's what they've really pushed is that we don't, right? Like, when was the last time you sent home even a hydrocodone prescription with a patient? Like, we just don't do it anymore. Even if we have like a
yeah,
broken
I think
arm or
and if we do, like, prescription is for
like 10 hydrocodone, I think is, yeah. So I think if we send patients home with a narcotic prescription, it's usually like 10 hydrocodone. It's nothing more than that.
Do you think that PCPs are as like controlled as we are in the ER? Because I mean, yeah, we've pretty much taken away narc prescriptions in the ER. We just don't do it anymore.
Yeah. No, I think that they are not as good as we are.
Mm.
After my back
Yeah.
injury, when I had a herniated disc,
Oh
I
yeah,
went to
yeah.
I went to urgent care. They gave me, I think, yeah, 5 to 10 hydrocodone or something like that. And then I went
Mm.
to my PCP, and I think he gave me like double the dosage and 30 of them. So I think, yeah, that's a slippery slope.
Wow.
Yeah, so I think maybe PCPs are a little more apt to prescribe. I don't know if that's because they don't want to see you again in 2 weeks or what that is.
Okay, I'm just gonna lay out a comment and then I am gonna allow you to kind of move on so that we don't get caught on this one. But I think that there is just a cultural intolerance or unacceptance of the idea that life is painful.
Mm,
And that is coming from someone that has never sustained like a long bone injury or a massive surgery or cancer. But I mean,
but
I
I
don't,
agree. Like a sprained ankle, you don't need hydrocodone. Like it's going to hurt.
but I
Stay off of
mean,
it. Ice, ibuprofen, Tylenol.
yeah, but even for like big things, like the whole reason we have these drugs is because we try to get rid of pain. And it's like we haven't had these for a long time. And we've been being injured and having things happen to us for all of human existence. And like we managed it somehow. Like there are not stories of people just keeling over because of the pain that they're in. Like there are other ways to cope that I feel like are considered adjunct.
Mm.
Um, anyway, so I do wonder about that.
I feel like we have treated pain though, like with opium, and they
Mm.
used to do cocaine, right, for dental procedures.
What?
And yeah, yeah,
Oh,
cocaine
okay.
was for dental procedures because they numb your mouth. And then what's the like in the early 1900s they did the ether,
Yeah, but
right?
still, I mean, you're talking about what, like 75 years or 125 years of I still feel like there's culturally an unacceptance of the fact that like I'm not going to get your pain to go all the way away. I
Yeah,
don't know what to tell you and there's only so many drugs I can give you and like we have to figure something else out.
yeah.
I say that so we're talking about like injury or these other ways that you get access. But my experience with treating like cancer pain, especially once they're on hospice, this once they're on hospice, it's okay. But until you get that designation, they tiptoe around giving pain meds. And you're like, what? Well, we don't want them to get addicted. Who the frick cares?
Yeah,
Why do you care?
right.
Get them addicted. But, like, could you not let them be torn apart by, like, their own cells that are killing them? Like,
Mhm.
why do we care if they're addicted?
Yeah.
I don't know.
Well, and so back to the addiction piece
Yeah,
is I feel like, yes, there's an intolerance to pain. So then maybe that introduces someone to the drug, right?
yeah.
Um, but I feel like the bigger issue and why addiction will always be a thing is I feel like more often it's they're treating some type of emotional
Mhm.
pain or wanting to be checked out. Like there's a level of depression or anxiety or just uncomfortable in your own skin that's what the addiction is actually feeding.
Just with opiate addictions, or are you talking
No, I
about
think that's all addictions.
that's all addictions?
Yeah. So, I mean, addiction is such a huge, huge topic, right? I personally think that we are all addicted to something.
Oh,
It's what we
uh,
turn towards, right? When we are uncomfortable and we don't want to be doing what we're doing.
mhm, yeah, maybe. I don't know that every addiction um, is a medication for something bad. I also think that sometimes it's the inability to um, say no to something that feels good.
Mm.
I don't think
Yeah,
that it's always in response to something negative. It definitely can be. You seek out that little like rush of whatever dopamine. They say it's a dopamine hit. I don't know if that's just
yeah.
like pop medicine, but do you think that addiction is a disease?
Ooh, let's just go there, right?
I assumed you were going to ask me that question.
Well, okay.
Mm.
No, I don't.
Oh,
And
Kelly, I didn't think you were going to say that.
I know, and that doesn't mean that I don't have compassion for people that are
Absolutely.
addicted,
I would
and it
not interpret
doesn't
it that
mean
way.
that, I don't think people can change. I think that when we label addiction as a disease, it's almost taking someone's ability to change themselves out of the equation. And maybe, I mean, I could be totally wrong with that, but I feel like that I feel like everyone has the ability to become an addict. I don't believe that certain people are immune to it or it's just not in their brain chemistry. I feel
You mean
like
like,
by life circumstances, your social status, your upbringing, your introduction to drugs at certain ages of brain development, I feel like that is what leads to addiction. I don't think that some people are just hardwired for it.
so, okay, a couple of clarifying things. I think I would phrase you said it makes it so that people can't change. I think that making it a disease takes the personal responsibility out of it,
Mm,
which I wonder if that's the point
mm,
to some degree of doing that because we think of diseases as something that we can't help,
yeah.
which is also not true for some other ones, if I'm honest, but we won't go there. Also, what I hear you saying is that like anyone is just a few poor decisions away from being addicted in a way that makes them non-functioning. Now, whether that puts them on the street or whether they have the social means to at least stay in a house,
Hmm.
um, like, is that what you mean by like anyone can be addicted? Like it's
Yes.
just you're an
I
addict, I guess.
yeah, and it means like people always say like my drug of choice, right? Like my
Mm.
addiction would be to nicotine because I love smoking. I think it's the greatest
Oh,
thing in the world. It's my little escape.
do
And
not
I
think it's the greatest thing in the
have
world. Stop.
no, if you've ever met somebody that just loves to smoke, that's just,
Yeah.
but I have to make that choice
Yeah.
to like, oh, that's gonna kill me one day. So I need to not do that. Other people, their addiction is to food. Other
Mm.
people, their addiction is to controlling their body and um, over exercise or starving themselves. Some
Mm.
people's addiction is to opiates.
I don't think that's actually the right application of the term. I
No?
don't, nope, I don't. I don't think that when you're talking about something that changes your brain chemistry
Hmm.
so aggressively like a street drug that is
Hmm.
literally designed to do just that, I don't think that's the same thing as a food addiction and surely not the same thing as an exercise addiction. I think that when we use addiction, the term addiction in those or like a sugar addiction, I and watch me defend the street drug addict, Kelly. So who saw this coming? Um, I think that to their credit is it is actually something more physiologically powerful. Whereas when we think,
Absolutely. Yeah.
huh?
I absolutely agree with that.
Yeah,
I'm just saying that, like, for sure, there's different levels of addiction, right? Like,
yeah, I
and
guess.
one thing can be like fentanyl is going to be so powerfully addictive that it's going to be that much harder to make the choice to not do it versus, exercise, right? That it can still be quote unquote addictive, but like it's easier to change because the level of addiction isn't the same.
I would say that I would be more easily convinced that someone that is quote addicted to exercise actually has an underlying mental problem, or that's not very nice to say, thing that they're trying to work through
Yeah.
than the average person that's addicted to fentanyl. You don't have to have anything be wrong with you to be addicted to a street drug. That's what they're made to do. If
Mhm.
you are working out 6 hours a day and only eating celery, you're compensating for something else, either like an organic mental, like maybe you, I don't know, have some like severe form of depression or anxiety, or have like some history of abuse and really need that control factor, or, like
Yeah.
some body dysmorphia thing that maybe some antidepressant meds would help. But like it would take nothing for a normal person to get a 10 pill prescription for Norco and then 5 years later be on the street. Like that doesn't, you don't have to be at risk to become that person. And I think you have to have other risky, yeah,
I
things. No,
find this fascinating because I feel like you are defending the
I
addict
know.
on the street. Great. I love that, Sam. I think that's amazing.
Don't
Um,
tell anybody. I have a
but it's
reputation of being
no, and I
unconventional.
think that that's a good segue into like how we treat addiction because
Mm,
if you truly do look at it the way that you're saying and that person on the street that's doing the fentanyl flop, where they're,
yeah,
bending at the waist, just hanging down, Um,
it's called a seven, I learned.
oh, okay.
Mhm.
What's
Yeah.
the 6?
What?
6, 7, come on.
I don't I don't know. 7, 8,
Anyways,
9?
so
No?
if
Okay.
you're looking at that person on the street, can you have the compassion for them that that could be anyone? We don't know how they got to that point, and it could have happened very quickly. And now their brain chemistry has changed in such a way that asking them to become sober is a bigger ask than probably any other addiction out there asking someone to quit.
Oh, see, that I actually would say see it. Maybe that's where we see the world differently. It was only your choices that put you there,
Mm,
because it's not actually like some, like I said, like if a true anorexic, like 22-year-old or whatever, like there's a lot going on in their head that has nothing to do with, I mean, they need a lot of help. It's
yeah.
not, I don't know how to phrase it in the right way, but they're trying to compensate for something. They're trying to get control over something. There's something that they need like real therapy for. And it was going to manifest in some way in them, and it just manifested in this way.
And I totally disagree because I feel like that addict on the street, they are compensating for something as well. They are compensating
Nothing.
for they have grown all okay. Mm. So
Maybe.
the people on the street, yes, maybe, but I would say most likely have suffered some type of trauma, some type of abuse. They have not had the social support systems that those of us that can stay away from drugs have had. But I also want to say you you can't make that judgment for everyone when there's so much human trafficking going on, and that is mostly controlled by making those people addicts. There's also the kids that come in that have never been taken care of and they become street kids and they become addicted at a very young age. We just don't know the backstory of every addict out there. And so to blanketly state that it is a choice that they have made that have put them there, I feel like that is a very dangerous statement.
But I think you can't hold both of those logics. What I was saying, which is fentanyl will get you. Like it's
Mhm.
like you don't have to be predisposed to it
Mm,
for it to change, or meth or heroin for it to change your brain chemistry. And then also say, but they have something going, yeah, they have something going on, and that's why they're actually addicted to it. Now, I agree with you. I think most of the people that truly live those lives have probably had a significant amount of trauma, now probably have what we would diagnose as like a mental health disorder, whether they're schizophrenic or just have fried so much of their brain that they
Mhm.
can't think straight, have probably sold their bodies, experienced horrific assaults that I can't even imagine. But I would argue that it probably goes hand in hand with the decision to do the drugs. And so at some point, maybe other than, and I have met, sadly, at least one, other than like a child that is sold by their parents and forced to do it, right? Or someone that is abducted and trafficked, which I'm not saying that that doesn't happen, but I don't think that that's 80% of the people that live on the streets, which is like the percentage that it would need to be to hold this argument to be how we make our decisions. At some point, you said yes. At some point, and I think that's what we're saying when we say like fentanyl addiction or opioid addiction or any of those drugs can happen to anyone at any socioeconomic level, and you can be caught in by it without being
Mhm.
predisposed in another way because you had to say yes. And that's what gets me, is that at some point you individually made a personal choice to say yes to something that is decidedly risky and not good for you. And I would argue that someone that has body dysmorphia or one of these other sort of control aspect problems didn't say yes to something. They were kind of, they're working through something in their own mind. They didn't choose that. Like an anorexic didn't say, yeah, I think today's the day that I'm going to stop eating anything. So that, I guess that's how I view it.
I think that the way that I look at it is, okay, um, I'm just gonna use sugar because I know that you love your sugar, right?
Yeah, it's fair.
At some point, you say, "Yes, I'm going to take a spoonful of sugar and put it in my mouth,"
Mhm.
and imagine how much harder it is to say no to a drug that is that powerful in your brain. Like, their choice to say no and change their life is, for me, beyond comprehension, knowing the amount that has, like, a hold on their brain because of that brain chemistry. So, I guess my question for you is, knowing that, okay, the fact that they're addicts, that's already there, right? Like, we can't go back and say that they just needed to say no the first time. Like, they're already out there. There's already this massive problem with fentanyl, with addiction. How do we then come at it in a way of helping these people or breaking that chain? Because we
But you
can't just say, well, you shouldn't have said yes,
but
because they
that's what
already
I
did.
but that's what I am. That's the yes that I am talking about.
Mhm,
I'm talking about the first yes.
mhm.
So
But it's already happened. So now
I know,
moving
but
on
now,
from that, how do
but you're
we
moving the buck. When I say yes to a spoonful of brown sugar, it's because I know that, yeah, it's not a fabulous idea. I will give you that. But it's not gonna, does not have the risk to upend my entire life in a way that I can't get out of. And so that's why I actually do think the first yes that puts you in that situation needs to hold more weight because of how intensely risky it is. And that's what I'm saying is these other quote addictions didn't have a first yes. They weren't asked. The proposition wasn't placed in front of them for them to make that decision. Now, the background that goes into it and how those people ended up on the street is very, I'm sure, individual for each one of them. But at some point, a yes was said. And so getting out of it is a totally different conversation. And I do agree with you. Once you're in the grips of it, it's not just as easy as waking up one day and doing it. And I think a lot of that is because they literally, like, there is no clear thought.
Mhm,
And I don't know, short of having someone pull you out,
mhm.
how you do that.
Well, I think that that kinda leads into this next thing that I wanted to talk about, because we have decriminalized drug use in
Hmm.
the state that I live in,
Hmm.
and a lot of people argue that's why we have so many addicts and homeless
Okay.
people in our city, is because it is decriminalized, but we also don't have the social network to help these people. So, we see fentanyl overdoses every single day in the ER. every day, multiple. And Narcan is now dispensed at the bus depot. It's, dispensed everywhere. And while I understand the hesitancy to continue to, some people believe that enables the addiction. I also wonder, at what point is it our responsibility as a society to forcefully pull these people out of their addiction, sending them to prison or mandating rehabilitation? I'm curious what you think about all of that.
Well, the end of that question took a real turn that I didn't see coming, and like, through the whole thing, was very stressed that I was about to get in just so much trouble. I don't like the idea of decriminalizing these drugs. Am just 100% not for it, it's about the risk
Mhm.
that's why I think it's not worth decriminalizing it. I think it
And the risk to the individual or risk to our entire society?
Yes,
Yeah.
both. I think these chemicals are just present so much. They present such a risk to the individual to live a life that just I don't think, not that I wanna tell people how they have to live, right? Or like the mandate that, but it is not it's not a lifestyle that is respectful to the human condition, maybe. So I don't think that anyway, so I don't think that living that way is, I don't know, there's just, like, some treatment of people that if you value human life, that's not a way that you would be okay with someone living. It then poses so much risk to the people around them, like, immediately around them, right? Because they are unstable, and could be violent, and then, of course, there's the disease spread that goes through there, and then just society in general, once that population increases, it just invites so much chaos and violence and disease. And so yes, the risk I think is too high. And I think keeping it criminal increases the weight of the decision in a way that, like, we need every way possible to de-incentivize this behavior, I guess might be a way to say it. Now, I I think there are a lot of drugs in the prison system. I don't have any data to back that up. I don't know why, but isn't that true? Like, that
Yeah.
there are.
Well, and
Yeah,
I wanna step in there for just a second. So,
okay.
because you're right, my question posed several things. I feel like when the decision was made to decriminalize drugs, I think the, um, the the intention behind it, the thought behind it was that these people need treatment, not jail. The problem with that is that we did not increase the ability to treat addicts. We
Can we treat them?
decriminalized it, but left them without the help that they need. I think drug rehabilitation centers just keep getting cut and cut and cut. And so therein lies the problem. If you're not going to send them to jail, then you have to be able to offer them some way out of this lifestyle. And we as a society have not come up with a good solution to that, besides just say no, which, as we know, does not work.
2 points. Do you think that drug rehab works? I have a one-word answer to that. And 2, is it enough to offer?
Well, no, I don't think it's enough to offer,
Yeah.
by evidence of it's not working.
Yeah. Yeah, yeah.
It's just getting worse and worse and worse, and we're having more and more deaths every single year. And the fear of an overdose isn't enough to stop. And so I actually am saying that I think it needs to become a legal issue again. I
Right,
feel
and
like some people are not going to stop until they are in jail for endangering themselves and the community by continuing to do drugs. And I say that with the heart of wanting to do something to help the situation, not condemning them, but saying that this is not what we're doing is not working. And if you're going to shoot up in front of my kids on the street, that's actually endangering our community in a way that I'm not comfortable with.
To say nothing of the actual criminal behavior that begets
Correct.
this type of, so I think the actual criminal behavior should be held responsible. You should be held. I'm going to ask a question. I do want to say, I think I struggle with the word offer, and I think that there's a place between jail and inpatient rehab
Mhm.
that doesn't exist, but maybe that's what we are craving, which is like, I don't want to send you to regular jail where there's drugs anyway, but the idea of trying to get you into like a facility, this building that kind of looks like an old folks home, that has like staff there all the time and is pretty and has food, also is not enough. Like, you
Mhm.
have to be mandated to go somewhere that you are not allowed to leave, where you are going to get the mental help that you need, fine, to be better at managing this risk that is in the world. But also, like, you're going to be here until you're clean of drugs.
Mm.
And not for 90 days, not for 2 weeks, not till you get bored and you want to go get another hit, or not until the friends that you make in rehab all
Yeah.
relapse and you relapse with them. Like, you're going to go work on the Amish farm for the next 3 years, and you're going to work your body, and you're going to learn the value of lots of things and re-love life again. And, and just, but you don't get to leave. you,
Yeah.
you don't get to leave until you're better.
It's
And you don't get
it's
to, yeah,
forced withdrawal, forced sobriety is what you're saying, which
yeah.
I don't necessarily disagree with, but here is where we are going to diverge because we
No, go
always
ahead.
do, is who pays for that? Because to me, sounds great, but that means that we have to vote for social services and an increased funding of social services so that we can actually make a change. Because who else is going to pay for that?
Right, but we already pay for an insane amount of stuff. I actually don't think that it's about increasing the money that we spend. It's about spending it in ways that are actually effective. And
Reallocating our funding.
to your point about, like, we decriminalized it because we're trying to be compassionate, and we don't want those people to be criminals because it's not their fault that they are the way that they are. And I mean, I guess you could not argue with that sentiment, although I have like real problems with it. It's not about being compassionate or not being compassionate. It's about the protection of a very civilized world that we live in, that has behavioral expectations and requires a responsibility from a high percentage of its citizenry to continue to function that way. And if we want to give that up, then fine, but that means that we're going to give up the type of security that we think of living in the country that we live in. And so I don't think you're right. We have to pay for it, and I actually don't think that's wrong, because it's to the benefit of everyone. But we pay for a lot already, and it is just, I
Mm.
think, as you know, dispersed in a way that makes you quirk your eyebrow and say, who's really getting this money, and who's really benefiting this from this, because it's
Mm.
clearly not the people it was intended to go to.
Mm.
So
Yeah, I think that that's a
uh,
good point, and I think that, back to the decriminalization, I think that it also started with all these people in prison for marijuana, which is legal in most states now,
yeah.
and is not killing people and making them homeless. And so I think that with the new fentanyl crisis, whatever we want to call it, that needs to be relooked at. There's
Mm.
differences in levels of drugs, and the consequences of using those drugs are very different.
And how do you keep up?
Right.
Honestly, how do you criminalize drug by drug? Because even in the ER,
Yeah.
I don't kratom, is that what it's called? Kratom?
Yeah,
Kram
actually, I was just gonna say it's like kratom.
Listen,
So kratom is
I
sold in gas stations.
oh,
So kratom is sold in gas stations and is legal, everywhere, and that was one of the drugs that was found in my aunt's system who passed away last year, who she did struggle with, alcohol addiction, and, after she would have a binge, which she would have every couple months, she used kratom to kind of, withdraw or like help with the symptoms of not drinking after drinking for 3 days straight. And it wasn't the alcohol that killed her, it was the kratom. And
Well, yeah.
it's like you said, how do you keep up with it? Because you can buy this stuff in gas stations and it'll be illegal, but it takes time.
Well, and you have to
Um,
have an industry to come up with the test to know that you're positive for it, and to ask a government that is intentionally built to move slowly in this
mhm,
regard, which I think we can agree we want. We don't want a government that like reacts with legislation quickly, because that's not going to work for freedom actually. But not even just, I'm thinking, what when I became a nurse, it was bath salts.
yeah.
And Kelly, God bless, I really thought people were snorting stuff from Bath and Body Works. It took me a long time to
Yeah.
realize that this is a totally I'm like, why are people I mean, I get it. It smells so good, but why? I don't understand. And then I went to like anyway, it doesn't matter. And I was like, oh, I see.
Well, and I
Um,
think that's kind of back to, I think, where we started is addiction will always be around. There will
yeah,
always be something that the human mind craves to alter itself for whatever reason.
yeah.
Um, so I don't know that there's an answer to the problem. I just think we see the problem and we know it's not getting better.
We didn't even talk about Narcan. I mean, you brought it up and then we just
I
never went
know.
back to it, but we don't have to because I think we're going to disagree on this.
Yeah, I don't know. It's yeah. There's a lot more we could talk about.
Mm,
I think that my liberal heart kind of bleeds for the addict more than yours does, but it's not just being a liberal. I think that it's just
rude.
I think that basically like we all see the problem and we all agree that we don't have a solution for it and we have different ideas of how to help these people and I just don't know that any of us are correct
Yeah.
because nothing has worked so far.
Okay, yes, you and your liberal heart, but I would like to kindly remind you that I was accused last year of having a bleeding heart, which I think everyone, that's exactly right. Right there. That's the response. So just know that in some circles, Kelly, I'm the bleeding heart.
I
Yeah.
I believe that by knowing what circles you are in sometimes.
Yeah. And I think you're right. There's no one solution. And we look at the problem like with the idea of Narcan. I see the instinct to be like, this is killing people and we have the solution. So we're going to mandate that it's available all of the time. And I get that. I think the more conservative, like classical small c conservative impulse is to say, but what other problems are we going to cause with this move, which is the play that has to happen between these two camps. And it's actually what makes our nation so robust is we have this one side that's like, no, let's act, and we have this other side that's like, yes, but will the solution be more detrimental than the problem? And those are questions that we have to ask ourselves about everything from social security to drug reform to tax reform, right? Like that's just
And
the
that's
question.
why I think it's so important to just have the conversation
Yeah.
because instead of just going on social media, and this is what really breaks my heart is we have a Facebook page that has the news for our city and
Mm,
mostly is car accidents or assaults or things like that and they always list the overdoses. And if you look at the comments, some of them are so cold-hearted of, you know, just let them die, like
mhm.
all the, and I feel like those kind of comments, while they seem like not a big deal to you, that's really just pushing us further apart from actually finding a solution and just saying, yes, they did make this choice. Yes, we did give them Narcan, but if that's not the correct choice, what is something else to try? And I feel like we as a as a nation have stopped having those conversations, and we just like stake our flag on this side, and now I'm opposed to you, and I'm not even going to have the conversation with you because you'll never change. And I think that's the exact opposite of what we need to do.
Right, because the other side of that is the discharge that I did, where I hand the mom the Narcan, and I'm like, here's your other dose of Narcan for your minor that I just had to give 2 doses over 8 hours to, right? And her response is, okay, so I give it, and then when can I give the next dose after that if she needs it? Wait, you're already like, there's no plan to change the behavior. There's just plan to fix it when she takes too much at
Mm,
16? Like what?
yeah.
And so the other view is like, well, if I didn't give you the Narcan, maybe you could help her change these decisions, but they lack consequence because you feel like you can reverse them. So why
Mhm.
does it matter? And it's exactly what you're saying. It's the play between those two things, which is not to say that I want this little girl to like die, absolutely, but it's like, do you understand the gravity of the situation when I reverse it for you?
Right.
um and so it's that there's a fantastic book by Thomas Sowell called the Conflict of Visions,
Mm,
and it's a slog, but it essentially goes through like the not creation, but the evolution of the conservative and the liberal, like lower letters, like just
yeah.
the idea forms, and he calls them the unconstrained and the constrained visions, and it's fascinating, but it essentially is kind of saying that, like, do you believe that the world makes people bad, like they're good, they start out good and the world makes people bad, or do you believe that people have the capacity to kind of just like, I'm oversimplifying it, but like be
Yeah.
bad organically, and we need to build a world that keeps them from doing that, and
Mm,
then how that kind of creates where we are now. But it is
yeah. It's two
it's
different ideologies, but I feel like if you truly like talk to people, most people have the desire to do good for the most amount of people. And I feel like the disagreement just comes on how we do that.
well, and the truth is it takes both of them.
Right.
It takes both of the ideas, and regardless of what you and I think of the Narcan, you're going to go get it for me and I'm
Mhm.
going to give it, and vice versa when you say that you need it.
Right. And
Like,
I'm not going to ask why they made that choice in the moment while I'm treating an addict in the ER that just overdosed.
right, more, I guess, yes, absolutely, but more of my point is like knowing where you come from and your
Mm,
liberal heart and my bleeding heart of stone. Like, we come together at the personal level to treat the human and to do good by them with the tools that we have in an offering of just like general goodness towards humanity, because that's what we do, and those big details don't matter in that moment, and that's what it
right.
should look like.
Yeah.
So
Yeah. No, I totally
even
agree.
when you can't get a line in a patient that's hypotensive, and I can't get a line in a patient that's septic. So,
Right. Yeah. That didn't just happen or anything.
takes both of us.
I want to apologize to our listeners. This has been a really weird and choppy recording, and we're not sure if it's the rain or one of our children messed up one of our computers. So if it ends up choppy, please forgive us. But no, I think that we could do a whole part two on addiction because we did not even talk about half of the things that I had written down to talk about.
I figured that was going to happen.
Yeah, I mean, it's such a problem. But I mean, I think we could do it the whole thing and just not on fentanyl, right? On all the other addictions and how we treat them. But I think we should just move on to pulse check.
Move into a pulse check. Okay. You can start us off.
Okay. I don't know if you'll like this question,
Oh, great.
but we mentioned it while we were at work the other day. Do you have a special nickname for
Oh my God, Kelly.
Okay, we won't ask that one.
Okay.
Everybody can fill in the blank with what I was gonna say. Okay, do you have a favorite child, and do they know that they're the favorite?
Ooh. I have some hashtag, what's the like unpopular opinion
Mm,
about some parenting things.
okay.
Um, one of them is what you call like the private areas. And the other one is, yeah, I 100% have a favorite child. It changes, but I will tell them when it happens because I feel like they need to know. I feel like it is an important skill in life to be likable, Kelly,
Mhm.
and to know when you're not being liked and to be able to read. And not, I'm not saying that you should grow up and be a fake human and that it's only about being popular and this and that, but it is a social currency to be someone that's just not like horribly off putting. And this is coming from someone that is prickly and sassy and off putting to a lot of humans. So I'm not good at this. Yes, currently it's my middle child. It's
Mhm.
often my middle child. He's so happy about the kittens that he just
Mm.
keeps giving me hugs and saying, "Mom, I just love my kitten. I have to get a Christmas present for you now."
Oh.
Um, but in different capacity, like I love hanging out with my oldest when it's just the two of us, but like he got a shot the other day and I thought I was just going to kill him in the doctor's office. It was so dramatic and horrible.
Mhm.
And um, so anyway, so yeah, I'll let him know, like low key. And my
Yeah.
youngest, he's just a blast.
Yeah.
Um, but but yeah, do you tell them?
Abs Absolutely. I'm actually almost the same, and it can change hour by hour.
Yes.
And I will tell them by themselves, and I'll say, "You're my favorite. Don't tell anybody."
Don't tell
And then they'll go and say, "I'm mom's favorite." Um, but no, I think it changes over time. It changes year by year. But yeah, my middle, he tends to end up on top more often than not. I don't know
Mhm.
what it is about the middle boy. They're just the greatest.
What are the
But I mean,
instructions?
my oldest son, he was such a mama's boy for so long, and so now it breaks my heart because he's like tall and his voice is changing. So then I like part of me is like holding on to that, and so
Mm.
you know. But let's sorry, I'm going to ask a second question because you brought this up. What you teach your children about what their body parts names are, because you and I differ on this very much. My children know the proper names for a penis and a vagina and all the things from a very young age, but you don't do that.
So I'm gonna push back on you. Do they really know the proper names? Because I feel like, and maybe my anatomical knowledge is waning in my old age, but when when you teach a daughter what their vagina is, it seems to me to generally mean their crotch
Yeah.
area, when that's actually not technically true. Like
So
the
you want us to
vagina,
say like, this is your labia majora, and
I'm
this
just
is
saying you can't set a rule and then not follow it and then freaking hate on me over here. When so that's yes, we call it a winky. That's their little penis. And my
Mm.
oldest knows the proper name, and that's fine. A little winky in their little bubbles. And I just don't want to talk about it. But I do feel like the over medicalization of it is a little sus. And I don't like that either. I know that the reasoning is like, well, that way, if anything happens, like they can describe what happened to them, blah, blah, blah. If my son comes home and says, Mom, so and so asked to touch my winky, I'm not confused about what he's talking about. I'm like, oh, do you mean like your elbow? Oh, do you mean your earlobe? No, I freaking know that he means his penis. Like, this is not, he doesn't have to use that word. So that's my rant about it. And there you go.
Okay, moving on.
I don't, are you a bath person or a shower person? If
Oh,
for luxury,
bath,
not for convenience, bath.
bath. I
Mm.
and our house has 2 bathrooms, only 1 bathtub, and it's the worst bathtub in the world because it doesn't have a sloped, back to it. It's, like,
Oh, yeah.
straight, and I didn't realize that when we bought this house. I guess I didn't pay close enough attention, and we've been living in this house for 11 years. Um, but I probably wouldn't have purchased this house if I would have really thought about
Stop
that.
it.
No, I'm not kidding.
Really?
I love taking baths. Growing up, my parents had a clawfoot bathtub, and so I
Mm,
used to love just like soaking in this bathtub. But no, I don't take baths anymore because my bathtub sucks. But I have a hot tub, so
that's pretty much a bathtub.
a really hot one. Yeah. But then you have to
Yeah.
shower afterwards to get the chlorine off, so that kind of defeats the purpose.
Mm. I feel like my bath, I like a straight back. Otherwise, I slide down.
Oh,
I like
I
this.
want to
I like
slide down.
and drowned.
No, I'm 5'10". My legs don't let me slide down into the water.
I mean, it's true. I can have my chest in the water or my knees in the water, but we ain't
Right.
doing both at the same
Yeah.
time. Okay. Well, I
Uh,
was just
Are
curious.
you a bath person then?
Oh yeah, I have to answer. I do like a good bath, but it's stressful. It's like a whole activity that I have to like get the stuff that I like in the bath. I have to get a new scrubber. I got to figure out something to entertain myself. Like I know I'm going to be in there for like 2.5 hours, do my face, do my whole, like it's a, and it's
Two and a
necessary.
half hours?
Well, yeah.
That seems like a really long time in a bathtub.
Well, okay, maybe I'm not in the bath. But it's a process. Like you have to put on, I have the couple masks that I do before, and then the dry brushing, and then get in and soak for a certain amount of time, and then scrub with the Korean scrubber, and then soak some more, and then scrub again, and then do another mask and get out and do all the lotion. It's just like
We do not
it's
take
a
baths the same way.
it's a process,
I just
and I need to
fill up the
do it.
water and plop in.
Oh no, no, no. There's a point. There's a reason. But man, I like a good shower. I could just stand there in that hot water forever.
Yeah.
So I
Hmm.
don't know. Yeah.
We're getting close to time, so I have
Okay.
one more question for you, and I
Okay.
think this is going to lead into maybe next week's episode or maybe in a couple weeks. What is your Harry Potter house and your Patronus?
Oh, okay. I am. What am I? Ravenclaw.
I was
Sadly,
going to say you have to be Ravenclaw.
I want to be a Gryffindor so bad, Kelly.
Oh,
They're
don't all of us. No, I
But
don't.
they're so cool and they get to be the main character and all the cool kids are Gryffindors and I want to be part of their group and the other Ravenclaw that we work with won't let me be her roommate at Hogwarts and she said no. Just don't want to be in Ravenclaw. And my Patronus is a winged horse, not a what is that? Not a
Unicorn?
no,
No, no,
no,
not a
a
unicorn.
unicorn
Oh,
has a
Pegasus.
horn. A Pegasus. I don't know. The thing says not Pegasus. It says winged horse, which I think has like some good qualities. It's fine. I'm not like, or a dolphin. I think when I was like in high school, I was a dolphin, which I don't like that at all.
Sounds like you're really unhappy with your lot in life in
Well,
Harry Potter world.
well, that will get us back to our other, yes, because I'm a 1 on the Enneagram. So I'm generally displeased with the situation that I find myself in and need to optimize it. Okay, what are you?
Oh, you can guess what I am with my bleeding liberal heart. I'm a Hufflepuff.
I thought Hufflepuffs were like aggressive and athletic and
No, Hufflepuffs are like we're the kind beavers. They're like,
oh,
yeah, they're the kind ones.
okay. I do want to be. Is Luna Lovegood? What house is she in?
Mm, I think, I think she might be Hufflepuff.
Ugh. Ugh.
I know you want to be me so badly.
Oh
Um,
my God. Okay.
but
Well, we can end
my
it there.
Patronus is a dapple gray stag,
That is
which
very specific.
it sounds boring, but when researched Harry Potter world,
Yeah. Okay.
apparently it's very rare and has all these great qualities, but we'll have to dig into that later.
I do love a good Harry Potter deep dive. I mean, the symbolism in it, the tripartite soul, like I need you to decide if you're a head, chest, or belly. Kelly, you got to figure this
Okay.
out. And
I
all of
am
that,
going to say probably chest.
probably.
Yeah.
I'm
You're
belly.
ahead.
Oh,
Oh, okay.
I think
All
I'm an
right.
opposite person. Okay, we got to go. This has been
Yeah.
fun. Well, yeah. Okay. Well, thanks for hanging with us. This is At the Nurse's Station with Kelly and Sam, and we'll save you a seat next time.
Bye.
Hey guys, this is Kelly from At the Nurse's Station. Sam and I would like to remind you that the views and opinions expressed on this podcast are strictly our own and do not in any way reflect the position of our employers. This podcast is for entertainment purposes only and in no way should be considered medical advice. As always, consult a qualified medical provider for questions regarding your health or medical conditions. We hope you had fun listening to us today, and we'll see you next time at the Nurses Station.